the Madhya Pradesh government has announced a special initiative to provide incentives of organ donation. The state will extend a guard of honor before the funeral so that the families of the departed donors feel proud of their decision. The Health Department has finalized a proposal and sent it to the state government for approval. Why is Madhya Pradesh government granting state honors to organ donors? News9 Plus Decodes. The rising rate of deaths of patients due to lack of organ donors and transplants has become a major worry for the health sector. To combat this, health ministries of many Indian states have introduced recognition programs. For instance, Madhya Pradesh's Directorate of Medical Education proposes to provide incentives for organ donation. The state will begin the practice as soon as September, provided the government gives its nod. The donors' family members will also be felicitated during the Independence Day and the Republic Day celebrations. The state has already conducted 60 successful brain stem donations. In Madhya Pradesh, organ donation for brain-dead patient has started in Indore. After this, liver, kidney and corneal transplants will begin in Bhopal and other cities. What is India's supply and demand gap in organ donation? According to National Organ and Tissue Transplant Organization, 16,542 people willing to donate organs registered themselves in 2023. Of these, 15,436 were living donors, while 1,099 did it posthumously. In 2023 alone, 18,336 Indians received organ transplants. According to the Directorate General of Health Services, about 25,000 liver transplants are needed every year, but only about 1,500 are done. Similarly, about 50,000 people suffer from heart failures annually, but only about 10 to 15 heart transplants are performed every year in India. In case of cornea, about 25,000 transplants are done every year against a requirement of 1 lakh. But the situation is improving. India saw a spurt in organ donations from 4,990 in 2013 to 16,041 in 2022. However, the demand for organ donation is much higher. What is the biggest reason for the mismatch in demand and supply? One obvious reason for the gap in demand and supply of organ donation is lack of awareness. A 2016 study by the All India Institute of Medical Sciences says non-acceptance of brain death was the biggest reason behind refusal of consent for organ donation in 83% of the cases. Donating organs is a big decision for an already grief-stricken family, more so if they are hearing about this for the first time. People are more likely to provide consent for organ donation if they are already aware of the concept of brain death and organ donation. Another significant reason for the paucity of donors is the absence of medical infrastructure. Vinod Paul, member of the Niti Aayog, says only around 750 institutes provide organ transplantation service in India. Religious and cultural beliefs are also among the leading causes for limited organ donation. The study also suggests that the distrust of medical health facilities may be responsible for this wide gap. Which other states have conducted such programs? Madhya Pradesh is not the first state to have introduced such a program to boost organ donations. Tamil Nadu government announced a full state honours at funerals of organ donors in February 2023. The Odisha government launched a scheme in February this year. Also, Andhra Pradesh government has started a similar scheme this month.